For lab this week, we are going to talk about upper extremity stretches and joint mobilizations. For video purposes, I will only be showing the shoulder stretches just because I think elbow flexion and wrist flexion and extension are pretty self-explanatory, so I think you guys can figure that one out during lab this week. There are a handful of shoulder stretches that will demonstrate passively, so I want you to think about how we can do them in the hold, relax, contract, relax, and the slow reversal hold, relax positions for lab this week. The first one is going to be teres major, so I'm going to ask the patient to bring his arm on top of his head, good, and relax. So if he isn't able to get into that position, that may indicate that the teres major is slightly tight. So what I'm going to do is have him slightly drop his arm in front, and he's just going to relax, and I'm pushing him further into shoulder abduction and slight internal rotation. You should feel the stretch right along here. For the latissimus dorsi, it's going to be fairly similar, except the patient is going to have his arm reaching back behind. So I want his arm here. Good, and then I'm going to stabilize the shoulder and provide overpressure. So again, think about how you would do this in hold, relax, contract, relax, and slow reversal, hold, relax. Next we have the anterior deltoid and the pec, so I'm going to have the patient supine, so lay with your head towards the other way. Good. And the patient is going to slide slightly off the table. Good. A little bit more just so the shoulders off. Good. I'm going to have his arm extended, and I'm going to stabilize the shoulder here, and I'm just pulling into shoulder extension. So you should feel that in the pec and then also in the anterior deltoid here. Good. Go ahead and sit upright for me. For the middle deltoid fibers and some of the more of the anterior deltoid fibers, I can have the patient bring their arm behind, and I'm just going to pull just straight into horizontal abduction. You should feel the stretch straight down the middle deltoid, some anterior fibers as well. For the coracobrachialis, I'm going to have the patient in anatomical position, so he's going to have his thumb up towards the sky, extend your arm. I'm going to stabilize the shoulder, so sit up straight, put your shoulder blades, good. And I'm going to bring him back slightly, and I'm going to ask him to turn towards his left side. Good, gentle. And you should feel that right along the coracobrachialis here. For the internal and external rotators, you're going to lay on your back with your head here. Good, and scoot slightly off the table here. So if we wanted to stretch some of the shoulder internal and external rotators, I'll show you two different ways to go about this. So I'm going to have his elbow into my hip just to stabilize it. My left hand is going to stabilize his shoulder, and I'm just going to push his hand straight down towards the ground. So this would be stretching his internal rotators because he's going into external rotation. I can switch my body position. Same thing, his elbow's going to go into my hip. I'm going to stabilize his shoulder and push him down into internal rotation. That would be stretching his external rotators. Another way to do this stretch is called the sleeper stretch. So go ahead and lay all the way onto the table. And you're going to lay on your side. So we want the arm at about 90 degrees of shoulder flexion and 90 degrees of elbow flexion. The patient is going to put his chin down into his shoulder. Yep, so just sound like that, perfect. Patient is going to grab their other hand and they're going to put it on top of their stationary arm, good. And I'm going to ask the patient to gently bring his hand towards the table as far as he can go. Go ahead and pull down. Make sure that your chin is here, it's just going to stabilize your shoulder.